Can you hear me?
Yes, I can. I can hear you now.
Okay, so we're waiting on Dr. Jayasimi, right? How are we doing?
Okay. I've sent the invite to Dr. Jason.
Jayasimi. Okay.
I think he's trying to get in
Okay.
because he keeps saying unable to join. So I don't know if I should just quickly call him to find out,
Um,
or you would want to do that, ma.
I don't have his number on this phone.
Okay, let me quickly do that.
Okay,
I
thank
just
you.
hope he doesn't kick you out.
Good evening. Can you hear me, Dr. Jayasimi? I cannot hear you. Falashade, is that something with you or with him? Please hold on. Let's wait for Falashade. I don't think she's back. So she's the one hosting. So maybe there's something going on with that. Can you hear me now? Can you hear me now?
I can hear you now. I didn't hear you before. Can
Okay.
you hear me though?
Yes, I can. I can. Good afternoon. Good afternoon, everyone. Sorry, we're running behind today. Technology, as usual, gets the best of us. I am
Yeah.
Dr. Toyin. I am Dr. Toyin. Today we have a guest with us, and this is Talamdi Live. This is Talk to Us on Talamdi. This is Talamdi Live. We have Dr. Ishmael Jayasimi here. He is a renowned hematologist, oncologist, and I'm trying to get his accolades. Well, it's so long, but he is a renowned hematologist and oncologist practicing in the US. He is currently at the Cowell Health William Beaumont. University Hospital. That's where he currently practices, and he sees a lot of people with cancers and sees a lot of people with blood disorders. So welcome, Dr. Jayasimi.
Thank you very much, Dr. Tui. It's a great privilege to have me involved in this discussion. I thank you very much for inviting me. Thank you. And
I
thanks to
thank you for your
everybody.
time. Yes. I thank you for your time and coming on here. So we're going to be discussing today, we're going to be talking about age appropriate cancer screenings. As we know, everywhere we look these days, it seems like there's cancer everywhere. What is cancer? What exactly is this cancer? Why cancer? And when we look at the population in Nigeria now, it doesn't seem like an old person's disease or as you age disease anymore. You hear people in their 20s, in their 30s developing some sort of cancers. So we're going to be having a robust conversation with Dr. Jayasimi. Let's first ask him, what is cancer?
Well, cancer, if I will, in a lay language, is uncontrolled growth in our body that inhibit our normal function of our body, and it take over our normal function. It affect
Okay.
anywhere in our body, not allow our normal function to work. What happen as a result of that, we may die as a result. Before that, we may have pain and on like that. As Dr. Toyin mentioned earlier, cancer is universal, does not discriminate. People say when you live long enough, you may have it. In fact, almost 90% of people diagnosed with cancer, for example, in America and global world, are 50 years of age or older. Most of the common question we have many times, why? Environmental, example, heavy cigarette smoking, pollutants in the air and water, pesticides, chemicals may contribute to developing cancer. Excessive
Mhm.
weight and physical inactivity, all of us may contribute. Unfortunately, unhealthy diet, excessive alcohol consumption, radiation exposures sometimes can contribute. And sometimes we happen to be unlucky, born in a family with history of cancer due to inherited gene alteration can contribute to cancer. Believe me or not, some of the medication we use too, and medical treatment, may also cause cancer. As Dr. Tony alluded to earlier, I used to think cancer is for the old, but I was wrong. Unfortunately, sometimes an equal opportunities. Anybody can get cancer.
Yes, yes, thank you. Thank you, sir. So we continue to listen and hear in the news this cancer, that cancer. And when we look at the Nigerian population and look at the African population, what kind of cancers occur commonly in men and in women?
Yeah, thank you, Dr. Tony. Nigeria, just like any other person in the world, may have cancer. The biggest one we see among our people includes cervical cancer in women, breast cancer in women, prostate cancer in men, colorectal cancer in women and men, lung cancer in women and men, liver cancer, oral cancer. Those are really the big ones that we face among our people.
So how do we prevent it? Because it's a scary thing when you hear someone has cancer. You're already equating it to death. And I know that it's not all the time people with cancer die. Some people are actually in remission, cured. So, how do we prevent this? How do we prevent getting cancer? What should we do?
The most important thing to prevent cancer, I have this question every day in my clinic from patients and family, and also from doctors that we are training to become an hematology oncology. My belief, power, knowledge is power. Screening, prevention can make big difference in preventing cancer, believe me or not. Because large proportion of cancers may be prevented, including all cancer caused by tobacco use and some of our unhealthy behavior. In fact, there was a paper a few years ago that mentioned 42% of newly diagnosed cancer in America, for example, can be prevented. About 820,000 cases in 2024 are potentially avoidable. So if anything we can do to prevent that, and that's what we're going to be talking about. Screening, checking for disease when there are no symptoms, can really help prevent colorectal cancer and cervical cancer by detecting and removing pre-cancer in the colon, rectum, and uterine cervix. Can reduce death rate for cancers of the breast, lung especially, if we stop cigarette smoking, prostate cancer if we detect it early, and also for all of us to aware changes in our body, like a new mole or lump under the skin, or lump in our breast, or discharge from our vagina, can result in early detection of cancer. Thank
Okay.
you.
Thank you very much. I heard you say screening is checking for a disease when there's no disease, and I would like everybody to note this. If I had a pen and and a notepad, I would highlight this. It's not when you start to have symptoms you go and check. Even before symptoms, you check to prevent. This is what is called screening. So you've talked about a few diseases and or cancers in men and in women. I would like to start with the common things we hear, at least in women these days. We hear about cervical cancer, we hear about um, breast cancer. Can you tell us a bit? How can we get screened for this? When should we get screened for this? I just said that it's not when it starts occurring. So we want to do something, be proactive before it occurs, so it doesn't occur. I heard you say some people in families might have this. So if in my family somebody has this, when do I start getting screening? How? Thank you.
Dr. Toyi, thanks a lot for the question. I agree with you. Prevention is better than $1 billion of cure. Let's take cervical cancer, for example. About 12,000 new cases of cervical cancer among our people. Unfortunately, almost 8,000 deaths. Why? Because when we presented very, very advanced stages that the option of treatment are very limited. This is why your question is well received. What can we do to prevent it? Particularly in women aged between 25 and 65 years of age. The screening method we have in Nigeria now, go to your doctor for visual inspection with acetic acid, commonly used in Nigeria, because it's more accessible and more affordable. Pap smear or do the cervical cell tissue and send for HPV DNA testing, which is available particularly in urban centers in Nigeria or some private facilities. We recommend this should be done every 3 to 5 years to start at the age of 25 years of age. Also, it's very important to bring to us human papillovirus is the main causes of cervical cancer. There is a vaccination now, HPV vaccination, recommended for girls age 9 to 14 as a preventive measure. Now also recommended for boys too. I urge you, when next time you go to see your doctor, ask for this vaccination. They are trying to make it available worldwide now. That can really help us tremendously. I think the purpose is to prevent cancer to be in an advanced stage, and we do not have to die unnecessarily.
Yes, thank you very much. So from what you said, I heard you say there are several ways for cervical cancer to be screened. You can do a visual inspection and then they paint the cervix with acetic acid. You can do a cytology where they take a brushing of the cervix, and then you can do HPV, which is a virus that is transmitted as though an STD, and they can check for that. So what is commonly available in Nigeria, what you said, is the visualization and the acetic acid, and it comes at a lower cost. But the other things are also available, and I know this because I ordered them in my clinic for my patients who need it, and I know labs in Nigeria that does this. Thank you for clarifying this. And you said that people at 25 years and above, women at 25 above, are the people supposed to get this. What if does my first question? Does cervical cancer occur in families? Is it something that can be genetically passed down? And if it
Cervical
is, what
is not
age?
very common, but what is important though, if somebody starts having sexual intercourse,
Mm,
regardless of the age, a lot of us
mm,
think that 2 to 3 years after that, even though if they are not reached 25 years of age, they should be having screening. Because that is
mm,
when they may be exposed to that virus. And I think that's extremely important. This is one of the reasons, too, that HPV vaccination now recommended worldwide to start at a younger age, 9 to 14 years of age. I could remember about 8 years ago, 7 years ago, when my friend was the pediatrician for my twins, they just turned 20, said, Dr. Jaisimi, can we do HPV vaccination? I said, what are you talking about? You know, and a lot of parents refuse. They get excited on that. But with more education, this should not be a problem. This is something
yes,
extremely important for our young people. Initially, they said for the grow, now also for boys too. I urge
yes,
people to please do that. Your question again, some grown now or men now have start having sexual intercourse at more younger age than we wish. They should get that screening 2 years or 3 years after. This is extremely important. And they can still get that HPV vaccination. By the way, HPV vaccination now are recommended now even up to 26 years of age, in some extent, even older than that. I can't
yes,
say enough of that for our people. We should take
yes,
advantages of this. Bill Gates Foundation have this in Nigeria, I was told, the
yes,
World Health Organization, and on and on.
yes.
Please,
I
we
was
should take advantage of that because this is killing our people big time.
Yes, I was going to say that the HPV vaccination can be received at most public health centers, if I'm not wrong, in Nigeria. They made it free of charge. I know there was a big push about a year ago, and they continue to push for it that people should come and get vaccinated. So let's move on to breast cancer. I know a lot of women are satisfied, just they say, "Oh, I've examined myself. I check my breast every morning when I'm taking a shower." Is that enough screening? Please tell me.
Why this is becoming more sensitive. I have a daughter who is 20 years old. I'm trying to find a way when to tell her. I always believe something though. I learned that a long time ago from my mom. She always said, if you are knowledgeable, you are more powerful. The same thing I approach medicine every day. When I train young doctors to become an internist, young doctor to become an hematologist oncology, I always stress this. I believe breast self-examination in any woman, monthly self-breast examination should be encouraged, especially among our people in their 20s, because we don't always have a formal screening tool. That's number one. Number two is what we call clinical breast examination by a physician. Depending on where you are in the world, maybe physician assistant, trained, or nurse practitioner, or even nurse, every 1 to 3 years. For women, starting from age 25 to 30 years, annually for age 40 and above. In some women with strong family history of breast cancer, they may want to start at more early age. I was just corrected a few minutes ago. The mammogram is actually available in Nigeria now. We should take an opportunity to do the mammogram, the screening mammogram. I am biased. I recommend all our people to start at the age of 40 to start doing that, unless they have a strong family history of breast cancer or they receive radiation to the chest, the breast, few years before, because of other conditions. I do believe this is extremely important. It saves life. Let me try to clarify that. I think it's extremely important. We know breast cancer, early stage breast cancer in this country, cause no symptoms at all. But what is important though, those patients, when we found it, we cure it earlier, believe me, we can save a lot of life. In fact, 100% of our patients living more than 5 years when breast cancer is diagnosed at the early stage. My point to all of us, do that screening. Even if you have it, you diagnose it early. It's like 100% you were alive for 5 years or more.
Thank you. Thank you. Let us move on because time is going. Let us move on to cancers and men. You talked about prostate cancer, and you also highlighted colorectal cancer as occurring something that can occur in both women, men and women. So let's start from prostate cancer. I know some people will say, oh, when you get to 40, you have to start testing for prostate, and a lot of men do not want to get a digital rectal examination because it's like an invasive examination. But please educate us. Can we just ask our doctor that do our prostate test every year without doing the rectal examination? Or what is the best? What is the best? How best can we prevent and be screened for this?
Doctor, thank you very much for bringing this up. The incidence of prostate cancer, unfortunately, are more than 70% higher in Black men, regardless of your ethnicity, than in white men, for the reason that we are not sure. In fact, the incidence of prostate cancer in African American men is among the highest anywhere in the planet. Deaths from prostate cancer are more than 2 to 4-fold higher in African American men than in any other ethnic racial group. This is where this is extremely important to be aware of these statistics and get tested for this. My bias, men aged 40 years and above, particularly of high risk. What I mean by that, multiple family member, your father, your uncle, have prostate cancer, to check not only digital rectal examination where you see your doctor once a year, ask for this prostate-specific antigen test once a year, in my opinion. Some people, they may do it twice a year. I beg you, ask your doctor, any black man, anywhere in the planet, particularly when you are getting older, for this test. They keep saying if men live long enough, he will have prostate cancer. It's like a breast cancer. I urge all of us to do this because we see this left and right. We get scared. We should have the digital rectal examination done. It's very simple. It takes 1 second. And the blood test to ask for is called PSA. PSA. If you find it early, we can cure it. You won't have to die from it. You won't have to be in statistics. I beg all of us to do that. It doesn't matter whether we're in the United States, we're in Nigeria, we're anywhere. Being black itself connotes a high risk of prostate cancer.
Thank you. Thank you. Can you lower your camera just a bit? I see your forehead and nothing else. Perfect. Perfect. Thank you, sir. So let's go on. We still have
Col-
not touched colon cancer, lung
col-
cancer,
yeah,
and liver cancer. Can we just
okay,
touch on those topics
sure.
before we
Colon
go?
cancer is another one we've been seeing more in the younger population, including black men and black women. Many times we neglect the symptoms, change in our bowel movement, diarrhea or time with constipation. We need to pay attention to that. We are now recommending when men or women reach 45 years of age and above should start doing fecal occult blood. It's a little card you get from your doctor. They instruct you to take sample of your stool to see if there is blood or not, or what they call fecal immunochemical test every year. My strong belief, though, if available, accessible, is to do colonoscopy every 5 to 10 years. If there are polyps, depend on the size of the polyps, depend on the multiplicity of the polyps, that might be done every 3 years. Because polyps is usually benign. They could be what they call pre-cancer, and we can remove it and take care of it. My understanding, Dr. Toyi, you could correct me, screening is not yet widespread due to limited access to colonoscopy in Nigeria. But if you are fortunate to have an access to colonoscopy, I beg you, get it done. Particularly if any one of your members of your family happen to have colorectal cancer at a young age. I will urge you to do that.
Okay. Yes,
Liver
yes. It
cancer,
is.
I'm sorry.
No, I'm sorry. I asked you three things and I forgot. Please go on.
Liver cancer is another one that kill our people, particularly with someone with hepatitis B or hepatitis C. Men, when you are 40 years and above, if they told you you have hepatitis B, please ask for liver ultrasound. Very simple, twice a year. And also check a blood work chemistry called alpha fetoprotein blood level, AFP, twice a year. Every 6 to 12 months for high-risk individual, I recommend people to do that. Lung cancer is a big deal. Years ago, lung cancer is like a taboo in Nigeria. You are supposed not to smoke, but unfortunately, things have changed. We are smoking. The first thing I will tell ourselves, especially our young one, please stay away from smoking. We have enough issue with environmental pollutant to begin with in the air and the water. If you smoke 20 years and more and you stop, we can't get a screening there's low dose CT scan of the chest every year. That has been shown to provide increased survival. Why? Because if you have the lung cancer, we might be able to catch it at very, very early stage and take care of it. The most important though, stop cigarette smoking.
Thank you very, very, very much. So colon cancer, like you said, or colorectal cancer, the gold standard is the colonoscopy, especially in Black people. And these days we start at the age 45, unlike
Correct.
before that we did 50, yes. And yes, there are fecal occult blood cards in Nigeria. There's the FIT test, which is the immunochemistry test, and
Right.
colonoscopy too, but not as much as all the other tests are not as cheap. So for cost effectiveness, you could do the fecal occult, and if there's an issue with it, then you can go on to do a colonoscopy. But talk to your doctor about this. And you talked about the smoking too. I tell people they seem to think, oh, it's just one stick I do a day. One stick is too much. As far as I'm concerned, you do one stick of cigarette, it's too much for you. You talked about hepatitis B and C and getting ultrasounds and getting AFPs. You also need to talk to your doctors about this, getting screened for this, doing blood tests and doing ultrasounds. There's so many other things we could talk about, but these are the little ones we are going to talk about and touch today. Again, this is Dr. Jayasemi. If you have questions for him, you can ask him if you go on WhatsApp and you send a chat or you call 070 660 7330. That's 070 660 7330. Or you go on Tell MDND, tellmdng.com. That is tellmdng.com, and you'll be able to reach him that way. Of course, you get to talk to the nurses and they'll listen to you and then transfer you to Dr. Jayasimi. So we're just going to leave a minute or two to read questions and see if Dr. Jayasimi will be able to answer one or two for us. Folashade, please, can you read the questions?
All right, thank you, Dr. Jaisimi. So we have a question from Born Lenaka. I'm sorry if I'm not pronouncing your name
No,
well.
you don't have to announce the name, that's fine.
I saw a content on the Instagram that says mammogram is dangerous to female. It sends radiation that in turn leads to the breastfeeding cancer we are guiding against. How true is this?
Yeah, this is not very true at all. In fact, the benefit of mammogram is much better compared to that radiation. The radiation they use in mammogram are very limited. The bottom line, mammogram saves lives. We see more early breast cancer now in this country, particularly among whites, compared to those patients like you and me and you that don't do the mammogram. By the time we come to our breast cancer to our doctor, it's advanced and we die quicker. Overall, that radiation they are mentioned is very minuscule. The benefit of mammogram outweigh that risk. I beg you, get this mammogram done.
Thank you. Thank you. Is there any other question there for us today or to say, talk about?
This just the question that's here.
Okay, all right. Let me just wrap up and we'll give a minute for anybody that has a question to ask. So this is Dr. Jayasimi. He's a renowned oncologist and hematologist, and he practices in the US. If you have more questions for him, you can reach out to him by going on tellmdng.com. You can go on Instagram too and send us a message, or you can do a WhatsApp call or a WhatsApp chat at 070 That's 070 660 7330. So, in the absence of more questions, I want to thank you for your time, kind sir, and for educating us today and encouraging us to get screened. Cancer is a reality. Turning our backs on it and saying, God forbid, does not mean it's not going to happen. It could still happen to anyone. We heard Dr. Jaya Simi say it's not, it doesn't discriminate. It's an equal opportunity giver. It gives to the rich and the poor. So get screened. And is that a question I see, Olashade?
It's not a question, ma. It's
Okay,
the
I thought that was a
details.
I beg you to do those screening. I will
yes.
share my personal story. I just had a colonoscopy screening yesterday. That's why I was not able to talk to you last night, believe me or not. And everybody that know me know how busy my practice is. I have to take that time off to do it yesterday afternoon. I stress to every one of us to do that colonoscopy screening. Don't wait till the cancer spread, then we can't do nothing. That's not all the advance. The best way is the prevention, in my opinion. That is what I
Yeah.
will work out, all of us to work out with. Extremely important to do this. Yes, I did my own colonoscopy yesterday. I urge all of us to do the same thing.
Yes. Okay. So somebody else is still asking,
Just
or she's
dropped a
still
question.
asking. Yes, what exactly are the causes of breast cancer?
The cause of breast cancer is not known. However, the risk factor for breast cancer are multiple. The biggest risk factor we know being a woman, unfortunately, that is number one. And also, as we get older, it's also a big thing for breast cancer. Genetic factors also play a role. Family history. There is a gene now we call BRCA1, BRCA2. Race, for example, we think is more common in white than black. However, when we see it in black, it's more advanced. If they do a biopsy on you before, they find what they call atypical hyperplasia of the breast, ductal carcinoma in situ, lobular carcinoma in situ. That is the risk factor. Aleminaki, such as your message at more early age. Late menopause is a risk factor. Unfortunately, when we delay childbearing, it's a risk factor. Hormone replacement therapy, people that get estrogen, is a risk factor. Obesity is a risk factor. Excessive alcohol intake is a risk factor. And if we receive high radiation to the chest, before the age of 30 years of age is the risk factor. So there's a lot of things, but at end, most people with breast cancer, believe me or not, have no family history at all, unfortunately. But it's one of the breast cancer we know a lot about that we can cure. We can take care of it when we find it early. Again, screening is important. Familiarize yourself with your body. It's okay to start checking your breast once a month at the age of 20 years of age. It's okay to see your primary care doctor to do the critical breast examination once a year. It's okay to pay attention to your body and your family history. And that will help us a lot. Remember, empower yourself, know your body. We can
Okay.
live longer and live a good, better life.
Thank you, sir. Someone asked a question that people in their 30s, what would be the appropriate cancer screening for them?
In their 30, I used to say, all your body, by the way, from aura, your mouth, your skin, is something to think of. And also your thyroid is important. Your lymph gland, look at your neck, under your armpit, your testes as a man, your ovaries. And don't forget, there's also other diseases, not cancer, high blood pressure, diabetes, obesity, and on and on. And those are all important, even your thyroid too. Anyone, in my opinion, 20 years or age or older, you should do periodic health examination. Of course, a cancer-related checkup should include that.
Yes. Yes. So you should
No
see
age
your
is the
doctor.
limit. See your
Yes.
doctor. In the olden days, I used to think you have to be 70, you have to be 80 before you could have this, you could have that. Guess what? I was wrong.
Yes. Thank you very much. So see your doctor at least once a year. This is usually my recommendation. If you've not been diagnosed with any health issues, at that your yearly visit, you get to talk to your doctor about what has gone on during the year. If you have a family history of any health issues, if you smoke, if you take excessive alcohol, and what age appropriate cancer screenings and age appropriate health screenings are needed, you get done. So see your doctor once a year. And again, you can visit us at tellmdng.com. You can schedule a wellness visit and have one of the doctors there see you and talk to you and give you age-appropriate cancer screenings and age-appropriate health screenings as needed. Thank you so much, Dr. Jayasimi. Would love to have you here again with us. Thank you so much. And I know the
Doc-
last time we talked about this, I'm sorry, we said we were going to have someone come and talk about medicine and spirituality because I know Nigeria is a very spiritual place. When things happen, we often will go to our pastors or our imams or whatever. We'll go and look for a spiritual solution before we look at doctors. So we're gonna ask someone who is a pastor and someone who is highly knowledgeable in medicine to come and talk to us about spirituality and medicine in 2 weeks' time. Thank you. Dr. Jayasimi, you have something to say to us.
Well, I thank you, Dr. Toyin, for inviting me. I truly believe it's a privilege, and I appreciate to be part of it. And I commend you for what you are doing for our people.
Thank,
Believe me,
thank,
it means a lot. It's more than what any money can bring to our people. I think God bless you and your family. I will be
thank,
happy. It's an honor to continue to be involved in this forum to educate our people so that we get a better life. If
thank
anything
you
I
so
can
much,
do,
sir.
feel free to call and test with anyone with cancer, any family. Please share, let us know what we can do to help you.
Thank you so much, Dr. Jayasimi. Again, this is Tell MD production. We'll see you again in 2 weeks' time. Thank you.
God bless you. Thank you. It's a privilege. We
Amen.
see you. Bye bye.
Bye-bye.
Bye.
Bye-bye.
Bye.